We are the North Lancashire Respiratory Team. We're a team, a small specialised team, and that basically is an exercise and education programme for people with chronic disease of the lungs.
It's been proven to be a really effective treatment.
It's recognised as a vital component in treatment for people with chronic lung disease. They managed to obtain funding for us to actually expand our service, and this was part of a whole project which expands the base. It's a very exciting project for us. We employed new staff. We were tasked with actually doubling the delivery of pulmonary rehabilitation. We'd actually reduced our waiting lists by nearly 2/3, and we were feeling, oh, you know, this is really what we want to do. And then COVID hit, and since then, you know, things have changed quite a lot.
Almost overnight, our service was, we were told we couldn't see our patients face to face. A lot of them had to go into shielding as well. But overnight, their support structure had also disappeared, if you like. They couldn't go out. A lot of them were frightened as well. They couldn't go out and do their normal activity. They didn't want to go to the supermarkets. So we were directing them where they could get help as well.
There was a lot of questions at the beginning. An immediate sense of being redundant on the job because, you know, what we did most and what we did best we couldn't do. But at the same time, there was a need to adapt very quickly. So you're coming into an environment you weren't quite sure what you're coming into every day. You wanted to do the right thing continually and trying to find what the right thing to do was.
COVID-19 can be very dangerous. You know, you can see by the numbers of cases in the hospital.
It's a bit like having an invisible lethal weapon.
Yeah, that you can't see.
That just, you know, plunges us all into this different world of non-touch, and it's just permeated every aspect of life. Yeah, if you work in the health service, you've got a few more notches on that lethal weapon. You've got couples who actually had COVID together, you know, went into hospital and one partner woke up to find that the other partner's died. Yeah. Too sick at the time to even realise that the partner had been admitted as well. You know, it's unquantifiable how that must feel. A gentleman whose wife looked after him in every way at the beginning. His goal at the end of the rehab programme was actually just to be able to shave himself, so that one task he could do on his own, and which he achieved. So things you wouldn't think about if you weren't compromised by chronic lung disease. Those were the things that you find in pulmonary rehab that give you the, you know, the great sense of pleasure and reward to see that that's happening.
We are very privileged to be able to go out and see these people and see how we can help them and see how we can hopefully get them on that path to recovery. I've got a 4 and a 2-year-old, so I'm busy with a 4 and a 2-year-old, but generally we like to get out and about. We like walking, getting some fresh air. That keeps me pretty busy.
Well, I was hoping to retire.
Keeping hold of it.
It's sort of got elongated a bit more. What can I say? It's just, it changes with demand. You work as much as you need to work. There has been an attempt to use these times to the best advantage. You know, we're constantly being asked, what ways of working would you keep now? We're trying to use every opportunity to say, we know this is a really difficult time and we've adapted, but what are we going to keep? What do we want to keep? And there are some things that we will keep.
We're not just the only people putting ourselves out there. You've got your teachers, your supermarket staff, you've got everybody who works with the community, with the public. I
don't think it's just the NHS. I think the whole world is very, very tired of COVID.
I think the NHS stood up and fought the challenge that was given to them at the end of the day.
You know, it's not driven commercially, it's driven by need. And I think everybody's very proud of that.
Don't get me wrong, since COVID hit, it's been really tough. That sudden change of role, the uncertainty, it's been brilliant, really good and really positive, but it's been hard.
I'd just like to mention the community and the support from the community, because I think it's been absolutely phenomenal. I hope we don't lose, that's one of the other things I hope we don't lose going forward. Really been so magnificent, the actual way in which the community, especially in the first lockdown, came together, but it's still happening. The food banks, the olive branch in Lancaster, you know, the things to be tremendously proud of for everybody living in the community.